Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Melanie Geiser. She is a healthcare public relations leader. Today's Kevin MD article is Antimicrobial Resistance Needs a Publicist. Melanie, welcome to the show.
Thanks so much, Kevin. Nice to be here.
All right, so just briefly tell us a little bit about your story and then talk about the events that led you to write this Kevin MD article.
Absolutely. So my training is in communications and public health. So AMR has always been on my radar screen as a topic of interest. I became acutely interested in it once my allergy list in my medical chart started to grow with an increasing number of antibiotics.
Yeah.
I started realizing, if I get an infection of some sort, the number of antibiotics available to me that I am not allergic to is dwindling. And there are really not very many antibiotics, close to being approved. So I started to get concerned. I was talking with some colleagues in the UK about this during a meeting, and they brought up the fact that AMR is in the news headlines in the UK all the time.
Mhm.
And I was shocked because we almost never see AMR in the headlines here in the US. And last year was a bit of an exception because there was a UN high-level meeting on AMR, and we saw a bit of a blip in the headlines, which to me just served to kind of, be a contrast to what we usually, it made it obvious to me that we really don't see it in the headlines in a typical year. And we really have fallen back to where we were before the high level meeting. We aren't seeing AMR in the headlines. So I started to get very curious about this. And I reached out to a couple of my reporter friends and said, why is this? One of them in particular has worked on both continents. So she's very well informed about what it takes to get a story published on the European continent and published in the US. And they both said it's because nothing is happening here that gives them fodder to write about. So there's nothing happening in Congress right now. There's not much happening in state capitals. There aren't any big splashy research findings that they can use as news hooks to write a story about AMR. And that's what they need. They need a news hook to really sell the idea of an AMR story to their editors. And I thought, this is what I do for a living. I work on behalf of healthcare and life science companies to elevate the visibility of issues that are important to them. This issue is important to me, so I should be using my skills to elevate this issue and get it into the headlines and really teach other people how to do that as well, because it's going to take some traction in order to get it back into the national conversation.
So when you talk to your colleagues overseas and antimicrobial resistance is in the news there, so what are the news hooks in Europe? Why is it in the headlines over there?
Well, a couple of things. I think that there is increased openness in European media to writing about things that are important for the public to know, regardless of whether the public happens to be talking about it at that time. I also think that, people are very close together. Countries are very close together. We're kind of isolated here. We have a country above us, a country below us, but the rest of it's just us, right?
Yeah,
And
yeah.
and so there isn't this sort of spatial concern that forces us to really engage and discuss issues that affect populations. We also have a lot of space. You and I are both in New Hampshire. I can't see a neighbor from where I am. When you're in Europe, a lot of times that isn't necessarily the case. And you do need to be much more concerned about conditions that impact populations.
So you mentioned that you had a personal stake when it comes to antimicrobial resistance, but for the larger population, why should we care? Why should they care about antimicrobial resistance?
It's a really good question, and I have an answer for that. The answer is I took the antibiotic that I'm most acutely allergic to for my entire life through the age of 40 and suddenly became allergic to it. I was so accustomed to taking this antibiotic periodically that I didn't even realize what was happening. It was my husband, who has no healthcare training and no healthcare background, who said, could this be the antibiotic that's causing this problem in you? And it's a good thing he brought it up. I don't think it would have occurred to me because I had taken that antibiotic so regularly and I had Stevens-Johnson syndrome, which, as you know, can be fatal. So we caught it in time. Really fortunate that he even brought up the idea that the antibiotic could have been the problem. But again, this happened to me out of the blue. with a drug I had taken for so long, so safely, with nothing but positive results. What happened to me could happen to anyone. And each time it happens, it knocks another antibiotic off the list of
Yeah.
possibilities that you can use to attack infections when they occur. And that's when things start to get scary. And I think, you're probably aware that there are some experts who say we're on the cusp of a post-antibiotic era as we speak. Some experts say we're already in it. What this looks like is kind of scary. It means, simple things like a urinary tract infection that affects so many women in particular across the world could become what was once sort of an easily treated, quick thing to handle could become lethal.
Yeah.
And that's sort of scary. It also makes a difference to the decisions you make around surgeries. Elective surgeries become a much more serious conversation about the balance of risks and benefits.
And certainly in the primary care and urgent care setting that I'm familiar with, I think a lot of clinicians were more pressed for time, especially in urgent care, where there's always an incentive to see more patients in a shorter amount of time. And sometimes a patient, for instance, comes in sick with an upper respiratory infection. Sometimes rather than talking about the pros and cons of an antibiotic, it's sometimes easier and quicker just to give them an antibiotic, and that may perpetuate that problem of antimicrobial resistance.
Yeah, overuse, misuse, and last year we had a lot of problems with drug shortages, and substandard quality drugs, for example, mail order drugs that may not come through sort of qualified channels, can all contribute to the problem of AMR and can make it exponentially worse. So yeah, it's a multifactorial issue for sure.
So you mentioned from your background as a reporter, sometimes in order for things to get published, there needs to be some type of public policy catalyst. What all personal stories or stories that you're hearing from patient advocates about the impact of antimicrobial resistance? Do stories like that get publicized? That help with the news cycle and getting this issue out there?
Yeah, in fact, one of the biggest suggestions I have in helping people get reporters interested in their stories is to really personalize it and humanize it. Even for scientists who are doing AMR research, putting a face on that research can help get them into the news. But I think, for people, for clinicians or for patients who have been through this experience of having a very difficult to treat infection, reaching out to reporters or even writing an opinion piece, writing a letter to the editor about your experience and talking about what you, your family, your healthcare providers went through trying to get you out to the other side on the healthy side of things can really, really help. Reporters really want that human face, the human impact of a story. And in the absence of splashy new research results or an impending phase 3 clinical trial readout or FDA approval, these are ways that you can really help get some traction with media and help get this back into the national conversation.
So you mentioned earlier about putting a face on science, like, right, humanizing it, personal stories. So tell us from a scientific standpoint, why is that so important in terms of putting that human face on it to make their stories resonate?
Telling a story in a scientific journal is an entirely different endeavor than it is when you're telling a story to a reporter who's writing for the general public.
Mhm.
Even if you're talking to a reporter who's writing for trade media, focused on healthcare or pharma, you really need to have something other than just those statistics and
Yeah.
the scientific findings to talk about in order to really get them interested, because they're writing for a larger public. They're not just writing for scientists or other clinicians. They're writing for people who don't have that background. And in order to really bring it to a level where people are going to read beyond the first sentence, they want them to read the whole article, they want them to click on things, you need to pull in facts and details that are of interest to a broader population. And that can be challenging when you have such a high degree of training and are so accustomed to using very technical jargon.
Hmm.
But what I generally recommend when people are talking with reporters, people who have this sort of scientific or clinical training, is to really think about things from the standpoint of the public, right? If you were talking to your 15-year-old nephew who hasn't gone to med school or who hasn't gone through a doctoral program, how would you explain
Hmm.
what you experienced to that person so that they understand? And what are the interesting things about the story from your own personal experience that you would bring into it to get that 15-year-old excited about it and maybe even want to go on and study it in school? Those are the sorts of things that are going to attract reporter attention and then allow you to get into the nitty-gritty details.
Now, you mentioned that sometimes we don't have that policy hook that gets these stories published specifically related to antimicrobial resistance. In your article, you talk about the Pasteur Act, a bipartisan bill that has stalled. Tell us a little bit about that act, or if you know anything else in the pipeline from a legislative standpoint that addresses this issue.
So there are a number of different ways that people have talked about creating legislation that would help address AMR. One of the ways that they're thinking about addressing it is by increasing the incentives for pharmaceutical companies to develop new antibiotic products. The reason this is important is because when you think about the development of a drug, it's a very expensive process, right? And so
Yeah.
there needs to be a market at the end of that in order to justify the cost to bring a product through the development process. When you're looking at antibiotics in particular, there's a disincentive because in order to be good antibiotic stewards, it requires limiting their use to
Hmm.
very specific circumstances and very specific periods of time, which limits the market potential for the drug, right? And so some of the things that legislators have been talking about to kind of address this situation are almost look like subscription plans. So like you and I might subscribe to a streaming service,
Yeah.
would look like the government doing something similar with a pharmaceutical manufacturer who makes a new antibiotic, paying a monthly fee regardless of how much of that antibiotic is needed by the
Hmm.
public, so that there's a degree of assurance for that pharmaceutical company from the get-go that if they are successful in finding and bringing a new antibiotic to market, that they will be able to recoup some of the costs of that drug development.
We're talking to Melanie Geiser. She's a healthcare public relations leader. And today's Kevin MD article is Antimicrobial Resistance Needs a Publicist. Melanie, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Well, the first thing I want to say is that reporters really do want to cover AMR. The people that I reached out to and asked them, why isn't this being covered
Yeah.
in the US? They expressed frustration about it. They expressed frustration because they understand the import of the subject. They understand its potential effect on entire populations, and they want to be able to do something about it, but we need to help them be able to do something about it. We need to bring them stories. We need to write letters to the editor, like I mentioned, or opinion pieces and get it into the public eye so that they can see the interest start to pick up. Once they see the interest pick up among the public, their editors will be more open to letting them write about these topics. Podcasts are a great opportunity to tell a really rich story, right? So sometimes a traditional interview where there is an article that results, they don't allow you as much opportunity to tell a rich story because from your 20 or 30-minute interview, only 2 or 3 quotes might be
Yeah.
included in the resulting article. But in a podcast situation, you get to tell your story with all of the rich detail. Then you publish it on LinkedIn. You talk about it on LinkedIn and get your audience engaged with it. That expands it even further. And these are little steps toward getting the topic the attention that it deserves.
Melanie, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thanks so much, Kevin.